Well, good afternoon. It's great to be back in Northeast Florida, kind of where we started this. How many was that? 4 or 5 weeks ago?
I think it was
Barely a month.
3 weeks ago.
3 weeks
I think.
ago.
Yeah.
So we knew that that what we were doing to protect long-term care facilities, while necessary, was creating a lot of angst, a lot of loneliness, a lot of pain for a lot of families. And so Mary Daniel helped lead this task force to plow a way forward. Mary Vahue, we have, of course, other members here with us today. When we look at kind of the approach that we've tried to take to this and other issues, I mean, our top priority from the very beginning was to protect our most vulnerable. And that's because COVID-19 disproportionately affects folks who are elderly, particularly those who are elderly that have underlying health issues. And so that was a priority from day one. And so we had to make decisions very early on in March about how do you approach this. So we did a couple things immediately. One was we prohibited, because remember, there was a lot of concern about hospital overcrowding. And so people were supporting policies at that time to free up as many hospital beds, including some states had policies to force nursing homes to accept COVID positive patients. We did the opposite because we knew that represented a hazard to our most vulnerable. So we prohibited hospitals from discharging a COVID positive patient back to a long-term care facility. We also required the wearing of PPE by all staff in the facility. And we sent, over the course of the pandemic, we put our money where our mouth is. We sent them over 10 million masks, over 1 million gloves, 500,000 face shields, 900,000 gowns. That's just to long-term care facilities in the state of Florida. And then kind of the third thing that we did right off the bat was prohibit visitation to long-term care facilities. And I remember when we announced it at the time, I kind of had a pit in my stomach because one, it represented the gravity of the situation that we were dealing with. It represented an acknowledgement of the risk that our most vulnerable were facing. But it also represented an action that would keep family members apart. And we were looking at a situation that didn't have a time limit on it. We didn't know how long we would need to do this. And so it was a very difficult thing to do. I think in hindsight, we had to do it. I think it was the right thing to do. I think what we did, combined with the testing that we've done in the nursing homes, keeping testing the staff, having COVID-only dedicated nursing facilities for safe isolation when you do have a positive resident, I think all those things have been very important, and I think it saved a lot of lives. But when you're looking at these things, it's not all whatever you do to stop COVID and it's good. You've got to look at other things as well. One of the things, so protecting the vulnerable was the top priority, and obviously these facilities are the tip of the spear. We also understood the need to make sure that we had hospital capacity. So even though we were barring hospitals from sending COVID positive patients back to nursing homes because we understood the risk of that, we were creating COVID-only facilities that they could successfully discharge people back to safely, where they knew how to handle COVID patients and where they weren't risking infecting other seniors. And then, of course, we did a lot over the many weeks and months to help support our frontline healthcare workers, whether it's PPE, whether it's additional staffing, particularly for areas that were having a lot of hospital traffic in July, and then bringing in a lot of medications when they were running low on things like remdesivir. I'd call the president, we get more down here pronto. And so that was very, very important. And then the third kind of principle that's guided us on this is to understand that to do well fighting a pandemic, you need a healthy society. It can't just be focus on one virus to the exclusion of everything else that we have going on. And so that meant things like keeping the economy going, which we've done over the last couple months and have continued to add jobs. It means giving parents the option to send people in person for K through 12 instruction. It means having universities that have students in person. It means continuing to do things that are going to strengthen our society, and because I don't think you can fight a pandemic very well when society is in the fetal position. And part of having a healthy society is understanding that human beings seek affection, that you have family members who, and many of the folks understand that they have loved ones who are in the last stage of their life. They're not demanding a medical miracle. They're not having unrealistic expectations. They just would like to be able to say goodbye or to hug somebody. So it was, I think it's difficult to think that some of our actions may have prevented. So do you want to?
Thank you. I am incredibly grateful to be here, to be a part of this. The support that we have received from you, your heartfelt, true support from the rest of the task force. Secretary Mayhew, you have been amazing, the way that you led us to come to where we are today. It has been 175 days. And I am absolutely thrilled. I'm going to cry myself. This is going to be one of those days, I can promise you, when our caregivers for compromise see that we're getting back in. It's going to be as if the days hadn't happened, because that first hug and that first conversation and rubbing their back and holding their hand will take away the pain that we've all been suffering for these last 175 days. I am absolutely honored to be a part of this. I think our recommendations will be the blueprint for many states to come. We do have the Facebook group for every single state in the United States, and I believe Florida and Governor DeSantis' actions will show that we are the leaders in this and that we can do this safely. We are going to see some cases, I know that, but I also know that I want to be with my husband and everybody else out there. Hundreds of thousands of caregivers want to be with their families. And to be with them, to be able to hold their hands at the end of their life is going to be a precious gift that we're grateful to have back. So I thank you from the bottom of my heart. Thank you, Governor.
Thanks for your activism, and we really appreciate your story was tremendous, and I think you made an important acknowledgement. Look, on anything you do, there's going to be some risk, so we understand that, but we really believe that you can mitigate this risk by what the task force has recommended and by what we will require. But you have to weigh that risk, and I think it is a small risk, against the certain harm of prolonged isolation, of the certain harms of not allowing people to be with their loved ones. So I think it was a thoughtful approach, and I think it shows, just beyond this issue, you got to have a can-do approach. Like, okay, we understand we're in a tough situation. We understand that there are obstacles, but we're going to find a way to do it. And I think this is probably the best, the best we could have hoped for at this stage. I don't think it's the end in terms of, what we could be doing going forward, but I do think that it was very, very thoughtful. And, I've had so many people tell me, just look, I've got a mother or grandmother, 90, 95. She tells me, like, I understand COVID. I don't want to get it, but honestly, I'm living to see my family. That's why I'm living, to see them. And so, you don't want to be in a situation where you're cutting off your nose to spite your face. I mean, this is very important, obviously, to the folks like Mary who are caregivers and family members, but those folks in these facilities. I mean, this is a huge part, of their lives to be able to have these interactions. So, it's going to be, it's not going to be without challenge to do it, but I just think that there's been so much demand to be able to get in and do this that I think they're going to really focus on doing it right, because when you have something taken away like that, and it's month and then two, and then now people have a roadmap going forward, and I think people.
Leadership, your clarity of focus was that our elderly were most at risk, that individuals living in residential congregate settings were most vulnerable to rapid transmission, and yet we also appreciated that we had facilities that didn't have access to PPE, that were still trying to adjust to ever-changing guidance from the CDC, from CMS. And so to try to protect and guard against the virus from getting into the facility, we made that painful decision around visitation. What we also understood is that no one could stop the clock, and that family members have been praying for this time. We understand that the restriction on visitation is absolutely counter to everything we promote. The human touch is absolutely critical. You know, I've shared throughout the pandemic, I had my 87-year-old mother living with me for almost 4 months during the pandemic. I also had my 25-year-old son living at home. And so I saw the multi-generational, but I understood how much my mother craved the interaction. And no one should be going this long without a hug. I'm so pleased with the work of the task force, the members of the task force. These are incredibly emotional challenges that we have faced, but the thoughtful engagement, balancing our concerns about this deadly virus against the need to support safe visitation. And I'm really pleased with the recommendations, with the report. I am confident that as people are able to visit with their loved ones, that there will be adherence to just the basics: hand hygiene, wearing a face mask. If they're an essential caregiver, or in there on a compassionate visit, they're going to wear appropriate PPE and adhere to hand hygiene, and we can keep our loved ones safe, but bring families back together. So thank you, Governor.
Thank you. Secretary Purdom.
Thank you, Governor, and again, echo my gratitude for what you've done. I've never seen government move so quickly as you did in the last 10 days. So you kept us on task, but more than important, you kept us focused on the task at hand. So it was really a privilege to be part of that. But I know that since this pandemic began, it's been a constant precarious balance between limiting the spread of the virus and also the need for life to go on. And I think, Governor, when you came up with your Safe, Smart, Step-by-Step plan, that was an excellent plan, because it says to the virus, it will not confine us. It does not define us, and we have to move on. And then all of a sudden, Mary Daniel comes along and provides that human element to that we cannot let this virus confine us and define us. And so she brought that to us, and all of a sudden, we're sort of like, this is what this is all about. And that's what energized us. That's what energized this lady here and the rest of us. It was a privilege to be part of that sort of dialogue. We made time because it was important to make time. And thank you for that, because, we've been all working really hard to try and focus on every day, day in, day out, trying to address it. Then all of a sudden you made it sort of, oh, this is the human side of this. This is why we're doing it. And all of a sudden it made us sort of like relax a little bit, because we're like, oh, this is what this is all about. And then it refocused us and re-energized us. And so what you're seeing now is a result of that. So thank you for that. And I know that you represent, caregivers of compromise, a lot of individuals out there. So we're really excited about sort of seeing this. And, and you've mentioned before, there's going to be another virus. And you mentioned this as well, Governor. We are Floridians. We are very strong, and we are sort of determined. And we're not going to let anything confine us or define us. We are going to work together on resolving these issues. And this is going to make us stronger moving forward. So thank you for sort of, reminding us of what's important. And, we're just, it's been an awesome effort, and I'll always remember this. I will. So thank you, Governor.
Thank you. Michelle?
First, I wanted to say I hope Mary gets a chance to put her cape up, hang it up for just a little bit. But it's been such a privilege to get to work with you, Mary, and for your voice to be so apparent and poignant and articulate, and so many people needing you to speak up for them. So, here in Florida, Alzheimer's, we have the second highest prevalence for Alzheimer's and dementia in the country. And I told you 60% of the folks living in these long-term care facilities have some form of dementia. we've always been so thankful because the governor has come out so early on in the game to champion these efforts, and not just for people living with Alzheimer's and dementia, but for seniors in general. So I felt like what we needed to do in the beginning to be protective, to take care of our loved ones in long-term care. And then we got to a space, as Secretary Mayhew said, where this has been long enough. As you said, this has been long enough, and we needed to come up with solutions. So I was grateful to be on a task force that really got to that fast. And what I love about our leadership and our governor and Secretary Prudhomme and Secretary Mayhew is we do get to it fast. So we met, and I feel like here we are again today, just a short bit later. I could get choked up thinking about the pictures, thinking about you hugging Steve, and thinking about where we are today. And knowing what that quality of life, or what those hugs and what that touch and what that interaction is going to do for so many across our state. So we've done a lot to get to here that I'm very proud of, and I can't wait to see tomorrow. So thank you to all of you, to you, Governor, to you, Secretary and Secretary. It's an honor to get to be here today, so thank you.
Thank you. Gail?
Yes, Governor, thank you so much for keeping seniors in the forefront from the beginning. Every press conference, you mentioned seniors. They were right there in the front of your mind and everybody's mind, and we do appreciate it. And you, Secretary Mayhew, for your leadership for this committee. This task force has done remarkable work. Secretary Prudhomme, of course, everything that you do as well. From our communities, we are so excited. I have to tell you, you have made over 100,000 seniors very happy today. And come tomorrow, they'll get to see their loved ones again and have some normalcy in their life. So I'm just so excited. And Mary, thank you for bringing this to the forefront, and everything that you're doing to take care of your husband. It's wonderful. So thank you.
Thank you. We probably should talk about what actually the recommendations and what we'll actually implement. Did you want to do that and give an overview? Do you want me to do it? I mean, I can do it.
Please.
Okay. So, and if either of the Marys want to chime in, but just kind of the broad overview about what we're going to do. So, in the baseline law in the state of Florida is you have the right to visitation. We obviously had to suspend that as part of the emergency to try to keep the COVID from going in the facilities. And so we did have some exceptions, of course. So basically, this is broader exceptions to the original rule. So it's not back to fully normal where, but it is allowing the visitation, which is important. So all visitors have to wear the PPE and then pass through a screening. So the screening, of course, the temperature check, but as we know, not everyone has a temperature who has this. Some of the symptoms that they look for, maybe a cough, sense of taste that's been suspended, some of the other COVID symptoms. And then they do ask a series of questions about, have you been to a crowded private event or something like that recently? And so that is a really good way to be able to try to identify anybody who may be symptomatic. And obviously, if someone's really sick, that's obvious, but really it's kind of the very mildly symptomatic folks who may get sicker as time go on, but they're very contagious at that point. All visitation has to be by appointment only. And long-term care residents can designate up to 5 visitors with 2 visitors at a time for visitation. There's no minors at this time unless there's compassionate care exceptions. And I've told the committee, we'll see how this goes, but I personally would be very comfortable with minors. I think if you look at the way the transmission is typically gone, every time they do sequencing studies, it's usually the adult infecting the minor rather than the minor infecting the adult. Now, obviously, a 17-year-old will be more likely to spread than a 7-year-old, but I'm very comfortable on an evidence-based perspective that that's something that we could get to very soon as well. No facility can allow visitors, though, unless 14 days have passed without the onset of a new positive case in either a resident or staff member. And the only exception to this 14-day rule is for essential caregivers and compassionate care visitors. So an essential caregiver is an individual who provides healthcare services or assistance with daily life, like bathing, dressing, and eating. A compassionate care visitor is intended to provide emotional support to help a resident face a difficult situation, such as end of life, a difficult transition, or some kind of loss. So this is I think it's smart, it's incentivizing good practices on part of the facilities, because if you do that, then you're going to be able to have the visitation. Obviously, your residents' family members will be very happy with that. I think we've now gotten to the point where we obviously had more prevalence in July at our facility. So the facilities, we have less prevalence
Yes, it was
now.
over 60% of the facilities that haven't had any cases over a 14-day period for either staff or residents. And that's an even higher bar than no new onset. So we expect that percentage to be even higher. And the other point that Mary championed during our task force discussions was for the essential caregiver, that those services include emotional support. And so as we look at that role and how important it is, we think about mental health in everything we do in supporting individuals. And because we have such a high percentage of individuals in our long-term care facilities who are suffering from depression, dementia, that emotional support is critical to their quality of life, to their health. So that was an expansion of that definition that I think even if a facility hasn't met the criteria for that 14-day, you can have family members designated as an essential caregiver. They can designate 2. Only 1 can visit at a time, unless it's an APD, an Agency for Persons with Disabilities group home for individuals with intellectual and developmental disabilities, then they can have 2 essential caregivers at a time visit. So that was a significant expansion for both the compassionate care and the essential caregivers. So really pleased that will be authorized immediately.
That was a critical piece, I felt like, a critical piece.
And I would also just like to thank all the administrators, the executive directors, and everyone that works in the communities for doing such a wonderful job taking care of the seniors and making sure that they were safe.
And I guess, Governor, we know that as we've gone through this pandemic, we have seen so many providers rise to the challenge. And we have seen silver linings in the catalyst for change in the delivery of services. We talk often about telehealth, the dramatic increase in telehealth. Well, for our long-term care community, we have seen some catalysts for change around their approach to infection control, what they've learned from the new guidance from the CDC, from CMS. Our job is to help ensure that that gets sustained, that when the crisis isn't at the door, that commitment, the continuous quality improvement, continuous process improvement remains a focus. So we protect our elderly, those with underlying medical conditions, but we allow family members to be absolutely connected and part of their lives.
One distinction to make as well, that the essential caregivers versus the general visitation. The general visitation is the 5 people, 2 at a time. They must social distance, so there's a 6-foot requirement for them. The essential caregivers, which was something I was pretty passionate about, you may touch. So there is hand holding, there is back rubbing, there is hugs. So we're going to see a lot of that in the coming days. I'm very excited about that. One other thing I'm excited about, if you don't mind me chiming in, I'm turning in my 2 weeks notice today. I'm not going to be a dishwasher anymore. I'm going back to being just a wife.
Well, well, we appreciate it. And I think it showed, that you were going to go through lengths to be able to be with your husband. Why shouldn't we go through whatever lengths we can for policy so that people like you all across the state, have the ability to be there with the people that you love. So it was a great inspiration, and I think that we'll put this into effect probably later today when I get back. I'll sign it, and obviously there are some criteria. So there's going to be some facilities that the remaining that still may have some lingering problems. Although, as Mary pointed out, once someone tests positive, it kind of lingers for a while. It doesn't mean there are new infections in the facility, and so we're looking at any new infections is really a thing. So there's going to be a higher percentage of these facilities that are going to be eligible right off the bat, and obviously have an incentive to want to keep it that way. Of course, it is easier to do it when the prevalence is declining in the community. And so when we were very low in May and early June, Mary and I were working on potentially moving forward with some visitation. Then as we saw the prevalence increase at the end of June and into July, we saw that reflected particularly in places like Miami and the staff and in some outbreaks in some of these facilities. And so that was a difficult thing. Even though we wanted to do this earlier, it was difficult to pull the trigger under those circumstances. And so, the virus obviously isn't gone, but the prevalence from where we are now versus where we were at the beginning of the July, it's just a much better situation for us. And we obviously want to continue to see it go in that direction. So we do want to see everybody's pictures. So you guys can work on that. And but we're just glad we were able to get to yes. So.
We should talk a little bit, though, about the dramatic reduction. So I think you pointed out yesterday during your press conference, there's been a 60% reduction in the number of individuals currently hospitalized for COVID since the peak.
Right.
We've seen over a 40% reduction in the number of staff in our long-term care facilities who are positive. The positivity rate right now is about 1.2% among staff in our nursing homes and assisted living facilities, incredibly low. We have seen over a 30% reduction in the number of residents who are currently positive for COVID. Again, dramatic reduction from the peak. It's slightly over 3,000 individuals out of 154,000 individuals who are residing in our nursing homes and assisted living facilities. So the opportunity to thoughtfully develop these recommendations exists because of the progress that we've made.
Yeah, no, we have, if you look at the number of COVID positive patients hospitalized, you'd have to go back to June to find the level that we're operating under now. Some counties, if you look at their July peak, they're much lower than their July peak. But if you go before their July peak, you'd have to go all the way back to April to find where they are right now, with this. And so those have been really good trends. And obviously, I think those trends on the hospitalizations were kind of signified by the decline in the people going to the emergency department for COVID-like illness, which we saw that peak that second week of July and started to go down. And now we're at levels like we were during the first 2 weeks of June. And so that's probably the best indicator about prevalence in the community, and I think that's a very positive trend that we did see early, and that really gave us confidence that we were going to see the hospitalizations plateau, and then of course we've really seen a dramatic decline. I mean, we were at almost 10,000, and now we're at
3,400.
3,400. And yesterday was the lowest. So 2 days ago, the Sunday, which usually are bigger admission days, was the lowest admission since mid-June. Today was even lower, or yesterday was even lower than Sunday in terms of new admissions to the hospital. So that's way down from where we were at the peak. So those are all good indicators. And of course, the hospital capacity and the ability to handle, that was the number one reason we did all this to begin with. That's what I said, you had to flatten the curve, slow the spread so that we could kind of figure out how to handle this. And I think in Florida, we used the time in May particularly to do a lot of the infrastructure that we've seen. All the hospitals had PPE, they had medications, we had the COVID-only facilities. Of course, we had other stuff with long-term care. So even as we were at the height of this in July, there was never a question about hospital capacity. I mean, we had probably 12,000 beds at the low point, and we always had 15 to 20% of ICU beds available, and obviously that could have been expanded. So from that perspective, that was something that we monitored very closely, and we're very comfortable with where we are right now. I mean, that 3,500 or whatever where we're at now, that represents probably less than 6% of all licensed beds in the state of Florida. And so it's very important. Obviously, those are all very important lives. But there's so many other health issues that are out there. And obviously, our residents in these facilities, they're dealing with a lot of these issues. And that's why I think it's just so important. I mean, if you have a family member has a terminal illness, the time is short. To just be told no We had said before, I mean, that's going to leave a mark on people's lives, and it's a tragedy that happened. I think we had to do it, but I'm not happy about it, and I was resolved to do something about it. So that's what we've done.
Governor, we should talk about too, and again, I'll speak to my own experience with my mother. I never realized how important it was that she wanted to get her hair cut. And for months, and my mother has.
That's in here.
Yes. For months, she kept asking why she couldn't get her hair cut. And so this was an important part of our recommendations, is to bring back the beauty salons, the barbers, with all the protections for adherence to infection control and the PPE. But that's a critical component to this report. Also, medical services. We want to make sure that any medical services that need to be brought in to support our residents with critical healthcare services, that they are in, very explicit about that in the report as well.
And I think, Governor, we're going to set the tone for other states. They're already starting to look. Colleagues that I have across the country have asked for our report, very much interested in what we're doing, and I think we're going to set a trend for the rest of the country with this.
And Governor, thank you for initiating the testing in our communities.
Yep.
I think that was so helpful and very beneficial for this whole task force.
Well, and when I was reading the report, I mean, it never occurred to me about like the beauty salon or the hair stuff. But if you think about it, I mean, the family, of course, is comes first. But then when you're in those types of situations where you're not able to have the interaction and a whole wide range of things, little things like that we take for granted, that matters. And that will bring a lot of satisfaction to a lot of people. And oh, by the way, we were told months and months ago how barbers and hairstylists were just going to be the scourge of spread. That hasn't been the case. They've been very good. They've taken precautions, and I think in Florida have done a great job. So doing that, I think will be minimal risk. But I'm really happy. The final thing I'll just say is federal government. So we don't require testing. And the reason is because, if you go get tested and you get your results 2 days later, it says negative, you could have gotten infected between now and then. Now, there are point of care tests that the federal government is sending to not all long-term care facilities, but those skilled nursing facilities in the state of Florida. So they will have the ability, and I think a lot of them probably have it now, but certainly they're going to be getting it over the next couple of weeks. So they will have the ability to do that. They are free to do testing for people that come in. And we're not discouraging that, but we believe that taking these mitigation steps, doing the screening, wearing the PPE, that is adequate. And quite frankly, not all these tests are entirely accurate. We do see false negatives. We do see false positives. So it's not a foolproof thing. If it's a false positive, you're denying somebody the ability to see their loved one illegitimately. If it's a false negative, then you could be a false sense of security. So they are going to have testing capacity at those facilities, and they may use it for this, and that's fine. I also think if you have proven antibodies, obviously that would be something, that I think facilities, if you have that and bring that in, they would really appreciate that, because that shows you that you're probably going to be in pretty good shape in terms of not being a live carrier. So, I'm glad that this came together so quickly. I know you guys had to work hard on it. And I think that this is kind of a model. I mean, this is the most severe mitigation that was done in Florida was done to protect the long-term care facilities. And as we've said, look, it had to be done, but that mitigation has costs. And so you got to figure out a way to continue serving the purpose of protecting people from COVID, but not shutting off all avenues of life beyond the virus. And so I think that we're showing we can do that here. And I think we're trying to show that we can do that, across the spectrum in the state of Florida. So I want to thank you guys again for all your hard work, and I'm excited to see some of the photos, and hopefully this brings a lot of comfort to the families and obviously to our residents in these facilities.